Hello students, welcome to Infinity IAS. Today we will look at the topic medical termination of pregnancy. This is an important topic for the prelims examination considering the fact that a recent amendment to the MTP Act 1971 was passed by the Parliament. So this makes it important for the prelims examination. So let's get into the details of this. What is MTP? So MTP is medical termination of pregnancy. The termination of pregnancy done by medical professionals under the legal guidelines, that is MTP. So what is medical termination? Here it is deliberate termination of pregnancy before the viability of fetus is called induction of abortion. So here deliberate termination, that is the termination of pregnancy is done intentionally for various reasons which we will look into later. Then the point is viability of fetus. What is viability of fetus? So when we see in embryology, that is the study of the embryo or the development of embryo in the uterus of a female, we see viability of fetus is that period of time after which the fetus can survive outside the uterus. So we know that gestational period of human beings is 10 months or approximately 280 days. So this is the time taken for the embryo after fertilization to grow into a completely formed human being. So it stays inside the uterus of the female for this much amount of time. But it might come out of the uterus before this period itself. We all hear of preterm labor, or we see children being born before this period is complete. So if the gestational period is 10 months, how can the baby survive before this period? So that is where viability of the fetus comes in. So if the baby is born before this period is complete, the baby can be survived by giving certain medical support to it. So that is viability of the fetus. This is normally taken as 28 weeks at this time. So as the medical technology or the conditions in the medical field improve, we can even make a child survive if it is born even before 28 weeks. But with the current technology and with current developments in medical field, 28 weeks is the minimum time period before which the baby cannot come out of the uterus. If the baby comes out of the uterus after 28 weeks, it can still survive with medical support. So 28 weeks is taken as the viability period as of now. So Medical Termination of Pregnancy Bill 2020. It's an amendment that is being made to the Medical Termination of Pregnancy Act 1971. So this act was enacted in 1971 and it allows for the termination of pregnancy for various reasons. The reasons include, one is if the pregnancy is allowed to continue, it might result in mental or physical abnormalities in the child. Second, if the pregnancy is allowed to continue, it might cause mental or physical harm to the woman carrying the child. Next, humanitarian grounds. If the pregnancy is caused as a result of something like rape, etc., it can be allowed to be terminated under humanitarian grounds. Next one is if the pregnancy is caused due to the failure of a contraceptive, then also it can be allowed to be terminated. As in, if the couple has used a contraceptive device yet it resulted in a pregnancy due to its failure, then also it can be allowed to be terminated. So in this case, we need to know that for undergoing MTP, in case of humanitarian grounds or failure of contraceptive, the woman does not need to show proof to the medical professional. So now comes the Amendment Bill of 2020. So what is the difference does this Amendment Act bring to the old one? So here we'll look into the new provisions. For prelims examination, these differences between these two acts will be very important. So here we'll go into the details. So as we have seen in the 1971 MTP Act, in the 4 reasons that can be invoked to undergo a medical termination of pregnancy, one of it is failure of contraceptives. So under the old act, it is applicable only to married women. So this creates a problem, as in if an unmarried woman gets pregnant and wants to undergo a termination of pregnancy, she can't legally approach a medical professionals. This leads to her going to unsafe procedures or approaching quacks. So these unsafe procedures or unsupervised abortions might even lead to the death of the woman. So in the 2020 amendment, this failure of contraceptive use has been extended to unmarried women as well. So this helps the unmarried women avail these medical facilities for the termination of pregnancy. So what does this gestational age of 20 weeks mean? So it means a woman can avail an MTP only till 20 weeks period after she gets pregnant. After 20 weeks, she cannot avail MTP in a normal way. So even this 20 weeks of gestational age is further classified. For example, till 12 weeks of gestational age, she only needs the opinion of one registered medical practitioner to undergo an MTP. From 12 to 20 weeks, she needs the opinion of 2 medical practitioners. So this is under the old act. 1 medical practitioner till 12 weeks, 2 from 12 to 20 weeks. After 20 weeks, she needs to approach the medical board and judiciary. This is a very cumbersome process and it gets very difficult for the woman. So after 20 weeks, if there was an abnormality that is detected in the fetus, it becomes very difficult for the women to undergo a termination of pregnancy. So this was a problem with the 1971 Act. In the new amendment, the higher limit has been extended till 24 weeks for rape survivors and beyond 24 weeks for substantial fetal abnormalities. So here we see the higher limit is extended and even beyond 24 weeks for substantial fetal abnormalities, it has been extended. And also opinion of medical practitioners, it has been eased. The conditions have been eased. So till 20 weeks, the opinion of 1 medical practitioner is enough. From 20 to 24 weeks, the opinion of 2 medical practitioners is required. So this is the difference that has been brought under the new Amendment Act. So here we see that 24 weeks. Beyond 24 weeks also, for substantial fetal abnormalities, a woman can undergo MTP. But she needs certain conditions. Those are, it has to be approved by the state medical board. So for this reason alone, in the new act, every state has been asked to set up state medical boards. So state medical boards need to be set up by the state government for this purpose, that is after 24 weeks, if the pregnancy has to be terminated, this state medical board will give its opinion. So, what does the state medical board consist of? Who are the members of the state medical board? That is also given in the act. This is important for prelims perspective. So here, one gynecologist, one pediatrician, one radiologist, and any other members as determined by the state government. So these are the members of the state medical boards that are appointed in case they have to give opinion for a termination of pregnancy beyond 24 weeks. So these are important points for prelims examination. Then one more condition that has been changed in the new act is if there is a breach of women's confidentiality. Under the old act, only a fine up to 1000 rupees was imposed on the medical practitioner. That is, if a woman approaches a doctor for medical termination of pregnancy, her details should be kept confidential. If the doctor leaks those details, it is called breach of women's confidentiality. And the doctor will be fined a sum of 1000 rupees. But under the new act, this breach of women's confidentiality can attract a fine and or imprisonment of 1 year for the doctor. So this helps the women to approach doctors in a less fearful way and avail these safe procedures. So these are some of the provisions that has been added in the new amendment. This is an important topic for prelims, particularly the differences between the old and the new act and the members of the state medical board. Thank you, students.